Heard at Health is sponsored video content brought to you by Med City News.
Hi, I'm here with Karen from CleverCare. Thank you so much for joining.
Thank you. It's a pleasure to be here.
Yeah, absolutely. And so to start off, let's just jump right in. What areas within health insurance do you think are most in need of innovation?
Well, first of all, let me tell you a little bit about Karen. So I started my career as a nurse, a registered nurse in Detroit, and that was important because I saw firsthand some of the challenges that happened for people who were in certain ethnic communities and the need for the delivery of culturally competent care. And so when I think about CleverCare, which I lead now, we're a Medicare Advantage plan that provides coverage to Medicare beneficiaries from a culturally sensitive and culturally competent way. We are thinking about innovation. And what's really important about innovation is that you think about benefits that are designed to ensure that people have the ability to access care in a way that promotes their health and wellness in ways that's important to them. So when we think about benefits, one of the things that we do when we think about innovation is we've got our benefits that marry Western medicine as well as Eastern medicine. And that's something that resonates with people. And so again, by doing and thinking about a benefit that is unique and really targets your membership, then you can be innovative.
Yeah, really well said. And going off of that, so you mentioned that providing culturally competent care is a key focus of yours. Can you talk a bit more about what that means and why it's important?
Yes, culturally competent care is really taking into account the attitudes and behaviors that are important to people around their health and their wellness. It is being sensitive to what may be different about them as opposed to yourself. And so when we design our benefits and when we think about how we provide that culturally competent care, we do it by making sure, for example, that we provide things in language. So someone's primary language, we have our member services team and they can answer their calls in their language. We marry that Eastern and Western medicine because it's complementary. And in a lot of ways for a particular ethnic background, that may be something for generations that they've utilized as a core part of their healthcare. And so when you think about cultural competency, again, it's about taking into account the behaviors and the attitudes that are really unique to a particular population, and then kind of building your healthcare around that.
Yeah, really well said. You also mentioned that CleverCare has a bit of a unique approach to blending Eastern and Western medicine. Can you tell me a little bit more about that?
Yes, it's one of the things that we're most proud of, quite actually. So when you think about your providers that people have access to, the doctors, the hospitals, etc., we've been very intentional around building a network that has providers in it that speak the languages of the members that we're serving. Another thing that we've done is we've married that Eastern and Western medicine. So we offer things like acupuncture. In fact, we have over 700 acupuncturists that we've directly contracted who our members can access. And again, that is very core for them, that complementary piece around that Western medicine.